internist myself. I'm glad to see more physicians in the United States Congress. I think that's helpful. I guess it's also a sign of the level of government involvement in healthcare continuing to go up, but you're still outnumbered by the lawyers. I'm just glad that you're there trying to get some good policy enacted. This is a tough time for the debate around healthcare reform, and one of my concerns is that because we've gotten so much stuck on this debate around the public option, a few related issues, there hasn't been that much public engagement around a lot of the other key elements of the reform plans that the President and some others in Congress have supported. And among those elements that really would amount to significant changes that the public should be aware of and need to know about before there is any action includes some major reforms in the insurance markets. The steps included in the President's framework and in the House bill, and probably in the Senate Finance Committee bill, would include addressing those problems of underwriting that were mentioned before, but doing so in a pretty comprehensive way that would also require all Americans to buy an insurance plan, and the details of that plan have not yet been worked out, at least in the Senate Finance Committee version. That's going to mean some potential premium payments for individuals, potentially some changes in coverage. Haven't had a lot of discussion about that. Also, if you're requiring people to buy insurance, for many Americans, that's going to mean they need help in paying for those premiums, especially depending on how generous those insurance policies are. That's where a lot of the cost of these bills come from, and we haven't had a whole lot of discussion about that, or about how to pay for it. You know, there have been proposals to reduce Medicare payments to providers, to reduce Medicare Advantage payments. That's the private health plans that weren't one in four seniors are in. And I understand there are a couple of studies coming out today, again, highlighting that it's the lower income seniors who aren't lucky enough to have Medigap from a former employer to be eligible for Medicaid who tend to sign up for that. Lower income minority seniors and so forth. Also, there's some important roles being discussed for individual responsibility. Everybody talks about the need for more prevention in our healthcare system, but I don't think it's going to be enough just to add a few preventive benefits. We need to make some more fundamental changes to support better lifestyles. People, when they take steps to be healthy, when they engage in wellness activities and things like that, getting better financial support and otherwise. Haven't had much discussion of that. Also in the category of individual responsibility and making choices, I think it would be a good idea to reform the way that our health insurance from employers is treated by the tax system. Right now we have a big open subsidy, which just about all economists agree tends to add to healthcare costs. Haven't had a whole lot of discussion of that either. Assuming that these kinds of steps don't add up to the savings that are needed to offset the costs of any new health insurance legislation, the President and others have proposed a kind of commission that would make decisions on behalf of the country to try to get costs back into line. We haven't had as much discussion of that as would be desirable. So we seem to be a bit hung up on some issues that are very important, understandable why so many people at your town halls are angry about them. And the point I want to make is that even behind those issues, there's a lot of other stuff in this legislation that we haven't really had a chance to fully engage the public on. I think if we're going to have legislation that moves forward effectively, we need to. Everybody remembers the Medicare Catastrophic Coverage Act experience in 1990 when we didn't have that kind of upfront discussion and public engagement around critical issues that affect them. And that leads to some of the ideas that you all have talked about. I do think there's very broad support for reforming the way that individual insurance markets and small group markets handle pre-existing conditions, particularly for people who have been acting in good faith and enrolled in coverage continuously and so forth. I think to do that, it's going to take a little bit more than some of the market reforms like buying across state lines. I think we're going to have to deal directly with the fact that people tend to sign up for coverage when they get sick, and that means we're going to have to take some steps to deal with high-cost individuals, maybe through people have had ideas of risk pools or subsidies for high costs. That's something that Senator McCain talked about in the campaign. We haven't gotten to those issues either. So I think there are some ways to move forward. It's just going to take a going beyond even the debates we've had so far, and I hope with your efforts we'll be able to engage on those issues.